Welcome, everyone. Five Wishes is pleased to present today's webinar, The Structure of Success, Key Components of Effective Advanced Care Planning Programs. My name is Darian, and it is my pleasure to facilitate the event. We are recording the call, and we muted all participant lines. If you need help, please email 5wishes@compartners.com or send a message in the chat box. If you're listening over the phone and you need help, please press *0 for the operator. This presentation will last up to 60 minutes and does include a question and answer period at the end. However, please do submit questions at any time by typing into the chat box at the lower left corner of your screen, and then be sure to click that send button. We would also like you to please take a look at the links box located above the chat area. Here are resources that you can view, save, or print. Simply click on the link of your choice and a separate window will open. This will not interfere with your viewing of the program. It is now my pleasure to introduce Paul Malley. Paul is the President of Aging with Dignity, a position he has held for 18 years. With over 20 years of experience in the field of aging and advanced care planning, Paul is a national expert, frequent speaker, and advocate for quality and dignified care at the end of life. Paul, welcome.
Thank you very much, Darian, and to everyone who is participating on this session, either live or listening in the future. We are very grateful that you're here and that you're part of this community. This is actually the third webinar hosted by the Five Wishes practice community for healthcare professionals. And even though, to be honest, I'd love to be able to see each one of you face-to-face and meet with you individually, and some of you have had the opportunity to do that with, but I still love that this format is a way for us to be connected to one another. We have several hundred participating in the live session from coast to coast and representing healthcare providers, clinicians, organizations of all different types and sizes. So thank you for making this a part of your day and for making Five Wishes a part of your work and your outreach to your community and to the patients that you serve. As we think about an advanced care planning program and making it successful and effective in a healthcare setting, I go back to the original rationale and the impetus for why we created Five Wishes in the first place. It was to provide a simple tool that people could use to make important decisions about healthcare in case of a serious illness. And really, even more importantly, to tell the people around them, their families, their caregivers, their healthcare providers, what matters most to them. And over the years, we've noticed some near universal truths. And you've probably seen this too. People want to have some control. They want to not be in pain. They want to be comfortable. They want to be surrounded by the people who they love. And while these are generally true, it's important to understand the unique needs of each person. So, for example, if they want people around them, who? If they want pictures of their loved ones, which pictures? If they want to include cultural or religious traditions, which ones and how? And here's the similarity that I see. In traveling the country over the past 20 years and seeing advanced care planning programs embedded within healthcare systems, we've also seen some near universal truths about what works and what helps people facilitate meaningful conversations within healthcare settings. And while there are some near universal truths, there is also not a cookie-cutter style program that can meet the needs of every healthcare provider or organization. And that's where Five Wishes comes in, as a document that provides a consistent framework that ensures the most important areas that we know matter most to people at the end of life, are explored, and that is incorporated into the care that we provide as in healthcare settings. That's what we're going to focus on today, how advanced care planning programs can show us what the consistent components are to lead to success, and how they can be customized for every particular organization. So, for example, I mentioned that today, as part of this session, we have healthcare professionals of all different types of organizations: hospitals, physician practices, hospice, home care, long-term care, any of those groups, some that serve populations in large cities, others that serve rural areas. And we fully recognize that the same things that work in one location won't work in the other. And that's what we're going to unpack a little bit for you today, is sharing the experience of the past 20 years and even just the past few months and what we've learned from you in this practice community and serving that back to you. We're happy to work with Kathleen Taylor, our 5 Wishes healthcare advisor. Kathleen brings more than 2 decades of experience in hospice and other healthcare organizations, and that includes experience working directly in patient and family care as well as in senior leadership positions. So Kathleen will walk us through today's presentation, and that will be followed by a question and answer session. So remember, as Kathleen is going through this presentation, you're welcome to submit your questions anytime in the chat box, and then we will respond to those questions toward the end of the presentation. Kathleen Taylor, I'll turn it over to you.
Thank you, Paul. I appreciate the lovely introduction, and I just want to echo thank you, all of you who are participating in the webinar today. We've had a really lovely response to our practice community offerings so far, and I think that a lot of what Paul mentioned is probably why we are having a nice response, because I think those of you that are using 5 Wishes tools in your practice have a resonance with the 5 Wishes approach and philosophy about decision-making conversations that are centered in humanistic values, and hoping that these conversations are compassionate and effective and help us discover and rediscover what matters most to the people in our care at every stage in their life. So just to briefly remind some of you, if this is your first webinar, that the 5 Wishes practice community is a collaborative community of healthcare professionals who use 5 Wishes program components, any of the components, for advanced care planning. And the goal is to enhance your outcomes and elevate your practice through sharing best practice stories, resources, information, and more, which is what we're doing today. So if you're using any components of the 5 Wishes program, and we'll talk a lot about the components of the program today, you are part of the practice community. And that's because we want to make sure that you are successful in using these components. So with this understanding of the practice community, I want to invite you to share your best practice stories. If your program is doing something innovative, or if you have made a meaningful impact, we want to celebrate and share your success. So get in touch with us so that we can explore highlighting your best practice story in perhaps a webinar like this, or a feature story, or some other way. And similarly, if you feel like, as we go through today's webinar or at any point in your practice, if you feel like you need some guidance about how to get to achieving best practices, contact us so we can see how we can help, because that's what we want for you too. We'll share our contact information at the end of this presentation so that you know how to reach us. So what we're doing today is we're going to explore what effectiveness can mean in advanced care planning. We're going to discuss the value of a program approach to advanced care planning and identify the core elements of advanced care planning programs. So when we talk about effectiveness, what does that even mean in the context of advanced care planning? Well, to define effectiveness, it's helpful to review some of the known benefits of advanced care planning. And research has consistently demonstrated that advanced care planning improves lots of outcomes. You see these listed here. And these outcomes, as you read them, keep in mind that these are benefits for the patients that we serve, for the organizations and systems that we work in, and for the clinicians who facilitate conversations. So increased likelihood that clinicians and families comply with documented wishes is kind of an obvious one, but some of the less obvious outcomes that we've been seeing through research are fewer hospital stays at the end of life, which we know is very important, of course, to patients they don't want to be in the hospital, but also to systems. Decreased likelihood of intensive treatments at the end of life, similar, no one really wants that. Increased enrollment in hospice care, and increased likelihood of people dying where they want to be. These benefits are also really helpful to clinicians who, when someone has an advance directive, clinicians know where to go for treatment decisions in a crisis situation, and they also know what preferences are documented, and that's a huge help for those of you who are working in difficult, intensive, critical emergency situations. In addition, I'm waiting for my slide to progress. There we go. There is a significant increase in satisfaction ratings of health providers when advanced care planning conversations are conducted. And there's decreased anxiety, depression, and stress for family members, and a reduced sense of burden and decisional conflict. So effective advanced care planning definitely makes a difference and has clear benefits that we can articulate. And I want to add, even though it's not on this slide, that burnout is getting a lot of attention in healthcare. I think everybody's heard about the clinical burnout epidemic. And burnout, as we all know, is exacerbated by workloads and processes that might make us feel that there's an erosion of the sense of humanity in providing care. And I'm not saying there is no humanity. I'm saying sometimes we feel too hurried and harried, and we've got a checklist, and it's hard to find it. And I really think that advanced care planning is one little oasis that provides an opportunity for patients to discuss with their health providers what matters most to them. And that's really what we all wanted when we became clinicians in the first place, was to help people and connect with them. And advanced care planning is an opportunity to do that. So I'm waiting for some research that demonstrates advanced care planning having a correlation with clinicians' experience of joy in their practice. And I'd love it if somebody wants to do that research with me. So as you can tell from reading through the benefits, advanced care planning effectiveness is not the same as completed advanced directives. We don't get these benefits that we're talking about just from completing an advanced directive form. So then what are the factors that contribute to these benefits that we're discussing? What goes on in effective programs? And it's really, I think, this set of factors that helps advanced care planning as an intervention be more likely to be effective. Informed decision-making, which is really just helping a person understand their choices in the context of their current circumstances and medical condition, if they have one. Exploration of their values, concerns, culture, experiences, and their personal perspective on quality of life and how those things shape someone's decisions and preferences. That's vastly important, and that doesn't really happen just with a completed advanced directive. It happens with really good conversations in advanced care planning. There's exploration, elicitation of a person's choices, which takes a little bit of skill to get to where somebody can actually talk about what it is that they want when they understand the choices. And then documentation that clearly indicates these choices and is accessible by the health provider team and the healthcare agent, and encouraging the patient and family to have conversations and to have conversations with anybody who's a stakeholder in their healthcare choices, because we've all seen the midnight family member who comes in that we weren't expecting. If we can encourage people to have conversations with anyone who might care about what's going on, those things are less likely to happen at the end of life. So to get to these things listed on this slide, to get to these factors, we need to have a program approach, which involves more than just advanced directives. It involves some things we're going to cover that lead us to those factors, but also a program that has all these factors is likely to have more impact, more reach, and more sustainability. So impact is really outcomes. When a program has impact, there are outcomes because it exists. And those are likely to be some of the benefits that we just reviewed earlier. The program makes a difference, and you know the outcomes because you measure them. A program approach allows you to have more reach, which is the ability to reach whoever it is that can benefit from the advanced care planning interventions and services. Reach is also buy-in from the organization that allows you to scale up the program and coordinate across the system. Our last webinar, we had WellSpan talking about their system-wide advanced care planning program. They had incredible reach, and it's because they have a program approach that allowed them to expand the program across all of their providers. Sustainability really results from the first two things. Advanced care planning programs are famous for fading away when the champion of that program leaves the organization. So there are lots and lots of programs that are wonderful that are really personality dependent. Sustainability means that a program is solid regardless of individuals. That we certainly want champions, but a sustainable program is institutionalized. And it will be so valued by the organization that it's embedded in practice, embedded in process, policy, and procedure. So these programs tend to last because they have a wide reach and everyone understands the impact. So when someone asks you about your advanced care planning program and they say, why do you do that? You need to be able to answer that question, and that results from all of these things. So because core program elements that we're reviewing today lead you here, I want to get to telling you a little bit more about why we're covering these today. Last spring, we sent out a community survey to all of our 5 Wishes Practice community members. Many of you received it, and many of you provided feedback, and we're still grateful for that. And stay tuned because we'll have another one coming up sometime this year. And here are a couple of noteworthy results from that survey. Less than a quarter of respondents have formal advanced care planning programs in place, which again is wasn't a terrible surprise for us, but it's noteworthy. And most respondents, nearly 77%, are not measuring the results of their advanced care planning efforts. Again, this wasn't a huge surprise, but it is a little sobering, I think, for everybody who's involved in advanced care planning programs. And what I really think is that this is reflective of an activity approach rather than a program approach. And activities are things like giving out 5 Wishes document. And because the document is so engaging and easy to complete and informative, it may have served as a standalone advanced care planning activity that people feel has value, and it probably does have value. I do think just giving out the document because it's got so much in it is of value. But we do know it's really difficult to sustain an activity-based approach like that, because when asked the question, so what happens when you give out those documents, it's difficult to answer that in a way that helps sustain the activity that you're doing. So I do believe it has value, but we want to get you to a place where you're able to articulate specifically some goals that it's achieving to do your activities. And that's pretty much why we built the 5 Wishes program for healthcare with all of these components that are necessary to be effective and successful in your advanced care planning endeavors. And we're going to cover most of what you see in these gears today, not exactly in depth everything, but if you have an interest or curiosity about something you see here that we don't cover in depth today, again, our contact information will be at the end of the presentation, and I encourage you to give us a call. Because the 5 Wishes Program for Healthcare is already structured, it's already developed, and all of these little puzzle pieces are in it and fit together. It doesn't require the investment that a lot of folks have a challenge with that feels like startup. Sometimes getting to a program approach is difficult because people need to develop content for that, or they need to develop a training. And the beauty of the 5 Wishes program is whichever piece you need, you can use that piece. So if you need 2 pieces or 3 pieces or just one, they all work together or they work on their own. And that's what Paul was mentioning before about there's really no one way to do it. If you want to save some time and effort and have a program that all coordinates together, you can use all of these components. And you can use any of them as well. So now that we know what effectiveness can look like, let's talk about what these ingredients are that can help to get you to an effective program. I'm not going to get too into the weeds about leadership today, only because we really covered leadership and champions in our last 2 webinars. Today we're going to talk a little bit more about some programmatic elements, a little less about culture, but I just want to say that leadership and having passionate champions supporting your program, that these are essential to having an effective and a successful program. They're also really important for expanding your reach and ensuring the sustainability of your program. And the best program leaders have the ability to influence the request for resources. They can help you get the resources that you need. They can influence the development of processes and the adoption of processes, because you're going to need those, as we'll talk about later. And they can effectively work with a variety of departments. That's why informal leaders are important. They're actually where the rubber meets the road, and your cultural ambassadors. And champions promote and cheerlead for the success of the program. Hopefully, all of your formal and informal leaders are also your champions. They are people with their own, likely, their own personal stories or professional stories about advanced care planning that really motivate them about why it's important. Leaders are also aware of other initiatives and projects that are rolling out and can help you with timing about expanding some of your activities to a program approach. So with that said, leadership's important, and if you want more information about that, you can refer to our first 2 webinars, which are on the practice community page. There's a link on the left there, and you can access those archives and experience those webinars for free anytime that you would like. So, in adopting a program approach, you're going to need goals and measures. Again, frequently programs start, and it's okay to do this, they'll start with doing one activity. And that, again, that can work and it's okay. But it's helpful to determine what it is you want to affect with that activity and why. What you hope will or suspect will change or happen if you're doing this activity is something we want you to articulate at the beginning. So one place to start is if there's a specific issue or a problem that's relevant to your organization and the care that it provides, and you think advanced care planning can address that problem or affect some factor that contributes to that problem, that can lead you to identifying a starting program goal. Goals and measures, of course, are two things that go together. Sometimes when I talk to people about their advanced care planning program goal, they will actually articulate what's more of a vision. And what I want to encourage you to do is, yes, have a vision. A vision is a broad statement, and we'll get answers like, what is the goal of your program? It's to make sure all wishes are honored. That is a vision of your program. So what you want to do with determining goals, because you're not going to have an easy time measuring all wishes were honored, you will have an easier time achieving a goal and an associated measure that's breaking down some of the actions that you think are going to move you toward that larger vision. So a specific goal might be something like, we notice that our advanced cardiac patients have a high degree of intensive life-sustaining interventions. So you can set a goal of initiating advanced care planning conversations with all of your advanced care, your advanced cardiac patients who have clinic visits in, say, 6 months. So then you've got a time-bound goal. It's specific. You know who you're aiming at. And then your measures could be something like the number of conversations conducted, the completed advanced directives, which is a favorite for people to count. And you can do that as a count or a percent. And then the rate of intensive life-sustaining treatments for patients who had versus did not have those conversations. So if the problem is we're seeing that they're having a high degree of intensive treatments, and you want to address that with advanced care planning, at some point you're going to have to measure the intensive treatments, which sounds really simple, but somehow this is difficult for people to get. And that makes it difficult to articulate what the goal is and how the program is meeting the goal. If it's possible, then you want to start with measures that are already available to help inform your goals, and they can also serve as a baseline for assessing your progress and any change that results from the activities you're doing in your program. Typically, most of you have got utilization data available. That's something your organization already has. So see what's in there that might help you with measures. And experience measures are also typically available. We'll talk a little bit more about what those are in a couple of slides. So if you're trying to reduce costs, say, then you're going to need to measure your actions. What are you doing in your advanced care planning program, and measure the cost, if that's what you want to affect. So these things need to be a what we're doing and what results from it. And that brings us to these two basic types, two main types of goals and measures, which can somehow, again, we're simplifying this because this seems to be a particularly challenging area for advanced care planning programs, so we're going to simplify it a little bit and talk about some ways to set goals and measures with this construct. Process measures reflect actions that are completed, and these are useful in understanding increases and decreases in your program activities, as well as how many resources are required, like staff time and materials that are used in carrying out any particular intervention. And generally, these measures are fairly simple to collect, and they involve counting. Generally, process measures and goals involve counting. How much of a thing are we going to do? So some typical process measures are number of referrals for advanced care planning conversations, and you might also collect who's referring. So Doc A referred 12 times. Number of advanced care planning conversations conducted is a process measure. Number of completed advanced directives in the health record, which is a favorite. And you might even measure number of people who decline conversations and then look at the reasons cited. So that's what process goals are, and they have their function. Outcome goals and measures help us look at what difference it made. So these reflect impact, and when you do the interventions, what difference it made. And these somehow are intimidating to most folks, but I want to tell you that outcome measures do not have to feel like you're doing a research project. You likely already have outcome data that you can use. It's already there. As I mentioned, utilization data, that's outcome data. If your intervention, your process that you were doing is having advanced care planning conversations with a subpopulation of patients, you can compare specific utilization rates of patients who did and did not have conversations. So you can get to an outcome. You look at your processes, we had conversations, we didn't, and then you get an outcome of what happened with utilization rates. And you can look at things like hospital admissions or readmits, intensive and acute care stays, emergency department visits, admissions to hospice and palliative care. A lot of the things that we talked about in the benefits, you can find some of those in your utilization data. I also mentioned experience measures are often available. Experience and satisfaction are two different things. I'm sure most of you are deeply familiar with that because we hear back about these measures all the time. They drive so many quality improvement projects. Satisfaction measures indicate how pleased someone was with aspects of care. Basically, how much they liked it. And experience measures really are intended to indicate perceptions of how consistently or how frequently best practice elements of care were experienced. So the questions tend to be about how consistent was this particular intervention. You can use these measures and compare survey data between people who received advanced care planning interventions and those who did not. That's one way to use these to see what outcomes you're generating. There might be pieces of your CAHPS surveys. Everybody has some version of that if you're receiving any Medicare dollars at all. A lot of people have Press-Ganey tools that have been developed to help you move specific quality measures, and there may be some experience data in those that can help you look at the outcomes of your advanced care planning efforts. Or you can create your own that are specific to your activities. Existing measures, something you've already got, have the benefit of giving you a historical look back, a comparison to look back at a baseline and then look at the difference since you began your intervention. But newly developed questionnaires that you developed specifically for this can help you ask questions that really are specific to components of the program, the activity that you're engaging in. So the main goal of advanced care planning is to ensure that we've got care at the end of life that's consistent with what people wanted. And it can be a real bear, but it is possible to do chart reviews to determine care concordance. It's difficult because there's a lot of elements that go into end-of-life situations. People change minds. People go through experiences that change what they want. There's when you've worked in this, you understand there's lots of things that can make it look like the care wasn't concordant with what was documented. But if you're doing really good documentation, which we'll also cover, then there should be a story in there that tells you how you ended up with the treatment that was received. So I think that's probably one of the hardest things to do in terms of a goal and measure, but it's really valuable when you can do care concordance goals and measures. So if this has addled you, as it does most folks, to talk about goals and measures, please know that we are available for all of you who are members of the practice community, which is everybody here. We're available for mentoring. If you just have a question or you're struggling or something, you can contact us and we can see how we can help you out. And if you want to get into some more in-depth help with really taking a deep dive into your systems and your processes and your program design, we do have professional program consulting. We can ask you some questions and see what you need, and then build a proposal for helping you out with either establishing or enhancing the program that you have. So just keep that in mind. You're not alone. Another core component of an effective program is always going to be conversation training. If you're doing advanced care planning, you just should be having conversations. I know people do it without having conversations and just giving documents, but I strongly encourage you not to do it that way. Please have conversations as well as giving out documents. So if you're going to have conversations, the people who are having the conversations need to be trained in some basic competencies and skills, which you can see here. So super important, of course, is knowledge of basic advanced care planning concepts and the benefits, like we talked about. Communication and listening skills, you can learn them. Some people are naturally born that way, but these are skills that can be taught and learned and improved. How to initiate conversations with people at all stages of health, because advanced care planning is appropriate at all of the different levels of care in your system. The core domains to address during the conversation, which is one of the things that's great about 5 wishes is, you know, they're broken out really easily, but that's not always the case. So you want to make sure that people understand clearly what should be covered eventually. It doesn't have to all be covered at once, but should eventually be covered. Providing information about a medical condition, if people have one, eliciting values and concerns, cultural considerations, and then when to refer to other professionals and team members. There's a time when you're going to need to call the chaplain, or if you're not a nurse, you're going to need to call the nurse, or if you're not a social worker or a counselor, you're going to need to refer to them. So we want to make sure that you do that. In addition to conversation training, it's a really good idea to have some ongoing pieces that are supporting what you did with the training in the first place. So just to do a big training and then not revisit some of those things can result in, you know, a loss of skill and people just kind of doing it the way that they've figured out, which might not be with the competencies you want to make sure are included. So I encourage you to have some just-in-time resources and guides. Those can be things like conversation guides, things people can use in the field so that if they get stuck or they're new at it, they have something to refer to while they're in a situation. Support mechanisms for all professionals who engage in these conversations, because, you know, they're not always easy. And it's nice to have peers who can support each other and encourage case discussion and sharing of best practices. Regular educational updates so that if there's any change in your practice or process, people are getting that information. And skills practice opportunities where people can say, hey, you know, I tried it this way and that really worked, or I tried it this way and it didn't. You want to give people these opportunities to keep their training fresh. So I'll tell you what we've got that does the things we just mentioned. Of course, we have our 5 Wishes online training modules through Relias Academy and Relias Learning. There are 3 modules, and they're really appropriate for every level of healthcare professional, and they cover everything from the basics to in-depth conversation skills. We have the Conversation Guide for Clinicians, which is a great just-in-time resource that gives even suggested language for folks about how to have conversations. And we've got custom trainings. We can come out and do a training designed for your specific needs. And those are helpful for groups that are having frequent conversations and in high acuity situations, where you're really trying to affect a specific change with your conversations. Those customized in-person trainings are helpful for that. So keep us in mind for that. Another element of effective programs, of course, is patient education materials, because this leads to that informed decision-making. And what I want to just put a flag in is to remind you that your advanced directive form is a patient education tool. It is. And make sure you are looking at that through the eyes of your patients or your community, whoever you're giving it to, and see if it's something that's helping them understand, what is this, why do I need to do it, what are the benefits. If you're using a state form, I hate to tell you, it's probably not. That's one of the reasons people love 5 Wishes so much, is that it does all of these things. It's clear, it's easy, it's appropriate for anyone. It clearly helps to guide the conversation, not just for the person completing it, but also for anybody who's facilitating the conversation. It's got simple instructions, and it's available in, is it 29 or more languages, Paul? I think it's 29.
That's correct.
29. So keep in mind that your document should be a patient education tool, and then make sure that it meets these things we've got on this slide here. Just as a point of interest, there was a research study that was done last spring that was in the Journal of the American Board of Family Medicine, and the Oklahoma State Advanced Directive and the 5 Wishes Advanced Directive were compared in primary care practices. Basically, it's like hear this or hear this. And what happened was the odds of accepting the 5 Wishes document were almost 4 times that of the state directive. And the results also indicated that 5 Wishes was favored over the state directive by both patients and clinicians. So again, it's not surprising, but it just goes to show you, when your materials help to educate, they're more readily accepted. So patient education materials, in addition to your document, we want to have consumer-geared resources that explain what this is and why we want to do it, materials that provide prompts and encourage discussion about not just the decisions, but people's values, experiences, and their goals, and decision aids that help people understand the care options and choices and what life-sustaining treatments are, or what they perceive them to be, and what those treatments involve. And these materials should be, again, clear, simple, attractive, easy to understand. They should be available in a variety of settings. I mean, where are your patients? Have these materials there. Offer them at various touch points across your care continuum. And if possible, again, provide these in a variety of languages. So what we've got in our program for healthcare is, of course, the 5 Wishes Advanced Directive document, which we talked about and you're probably all familiar with, and the 5 Wishes Conversation Guide for individuals and families, which is a lovely guide that helps people through all of the considerations in the 5 Wishes document. It would help even if you're not using the 5 Wishes document, to be honest. It goes beautifully with it. But I think it's a lovely guide anyway, just about the considerations, conversation starters, good times to start a conversation. So it's a wonderful piece, and we've had people really resonating with it. We can't get out of here without talking about documentation practices, which is not the same as the document itself, but it's how you are practicing the how you are completing them and storing them and telling a story in them. So your completed documents should indicate really clear choices, clearly identify a capable healthcare agent, not 2 or 3, but clearly identify a capable healthcare agent, and capable I should probably overpronounce. So that involves having a discussion at some point about what the role of the healthcare agent is. They should be readily available in the health record, and they should be appropriate for the person's current health condition. If it's 10 years old and they were diagnosed with CHF 6 years ago, you don't have an effective document. This isn't going to help you achieve those benefits of advanced care planning. Also, if their healthcare agent is their wife and they got divorced 5 years ago, these things need to be updated. So that's what we mean by being appropriate for the current health condition, their setting, their social support, and their current circumstances. So these things all help the advanced directives to be honored because these are the practices around it. In addition, I want to say something about narrative or notes areas. There's not enough discussion about the importance of the notes or the narrative in advanced care planning. I think generally what happens is clinicians access the document in the record, but they're missing the story of the person, of who this person is, and what conversations have led to the decisions that are documented in the charts. So if you have, and you probably do, have a way of writing some things in the notes sections or in the narrative around the advanced directives in your chart, please make sure to use that, and then please make sure to access it. If you're looking up the advanced directives of a patient, look at the notes and see what happened in the conversations, because not all of that, no matter how great the document is, not all of that gets reflected in the document. A lot of it gets reflected in the 5 wishes document, but there may even be pieces that aren't. The great thing about 5 wishes is there's an area to write in. So if people are completing that and then it's scanned in, you've got that information in wishes 3, 4, and 5 that can be in the record. So there are going to be, I can't talk about all the possible processes and workflows that you're going to need to consider, but this is one that you're always going to have to consider. And that's what some people call patient identification. It's really identifying opportunities for advanced care planning interventions. And one of the easiest ways to do that is just to build in some triggers into your processes. And triggers are mechanisms that allow you to use various criteria to flag opportunities to initiate or to continue advanced care planning conversations or activities. So they can trigger the beginning of your process or another phase in your advanced care planning process. And they can be based on a variety of factors depending on your program goals and your patient population and what information you have available. So some of the triggers that I just want to throw out there that you can use are clinical indicators, which would be things like a specific diagnosis. A lot of people use advanced cancers or heart disease as a diagnosis trigger, a significant decline in function or their condition, a new diagnosis of a life-limiting illness, life expectancy, functional assessments. Those are all clinical indicators. Process indicators would be things like it's an annual wellness visit. It's time. That's the process. We always do it at this time. Process indicator could be admission to a particular program, admission to a hospice or palliative care or post-acute transition care. Change in care setting or level of care is a process indicator. or just that there's no advance directive on the record would be a process to look at. Situational indicators would be things like changes in social support, like we just mentioned, or a death in the family, or high-risk circumstances. There's utilization indicators, which are things like frequent hospital admissions, post-acute care status, and referral indicators are pretty much what they sound like, which is referrals from other providers for having the conversation, or the patient referring themselves and requesting an advanced care planning conversation. And in addition to those, there are going to be all kinds of other processes and workflows that you might want to consider. You don't have to do them all at once. Again, you can start with one activity and then build in other components to take a program approach. And if you do good goal setting and measures with your one activity, that will lead to you being able to communicate your impact. That will allow you to help expand your reach. That will allow you to make a case for getting more resources and make sure your program is sustainable. And all of that rolls into you being able to have more benefit for the people that you're serving and for the organization that you're in. So some of the processes and workflows you also are going to, depending on what you're doing, you're also going to look at things like how are the people you want to have conversations with going to be made aware of your program. How, as we said, what are your triggers? How are you identifying them? How are you going to provide them with materials? Which staff members are going to have the conversation? How are you going to follow up on the conversations? How will you conduct your training? All of these are going to involve some processes and workflows. So, eat the elephant one bite at a time and let your successful components lead you to another component so that you get to that program approach not through struggle but through success. And with all of that we've crammed in today, as promised, this is our contact information. So I'm Kathleen Taylor. You can contact me if you have a best practice story. If you're one of those people who's feeling a little challenged by goals and measures and you just want to discuss some possible mentoring for your practice, we can talk about that. Joanne Eason is our Vice President of Partner Relations. She is the person to go to for product information, for customization ideas, for partnership ideas, and she's amazing. And Paul Malley doesn't like when I say this, but he's the guy to go to for inspiration. Paul is probably one of the best advocates I've ever known for advanced care planning. And he's over everything that we do in the 5 Wishes program and with Aging with Dignity, so an even larger scope than we have in the 5 Wishes program. So please contact us if you need anything. And with that, Paul, I'll hand it over to you to see if we've got any questions.
All right, sounds good. Thank you so much, Kathleen, and especially appreciate your real-world experience in healthcare that you bring to this and really understanding how these conversations play out at bedside and in family living rooms and everywhere in between. That's a great wisdom that you bring to this discussion, and we're grateful for it. As a reminder, we have just a couple minutes left on our time available to answer any questions that you'd like to send for us. You can submit those in the chat box. We do have a couple that have come in, one that came that's similar to one that we hear often, and this came from someone, looks like working in a hospital, and they asked, they said that they have been assigned to create the advanced care planning program in their hospital, and they're just starting, and what advice do we have for them as they start? It sounds like they might be a little overwhelmed by knowing what to tackle first. Kathleen, any advice on where to start for the person whose job this now is to create an advanced care planning program if one doesn't already exist?
Well, I think that's the question, is to look at, if you're in a hospital system, somebody's been doing some form of advanced care planning because they have to. So I would start with finding out what has been happening and then looking at what out of that is working or not working, and you can see if there's any apparent strengths or weaknesses in what's already being done. Not knowing anything about where you are or what's going on, I would say you can also contact me, and that might be one of those situations where we can spend a few minutes talking about your situation and seeing if I can help you find a starting place.
Sure. And I liked your analogy too of not being intimidated by the elephant that's in front of you. And another way to put that is looking for the next right thing. If you're developing a program within a healthcare setting and there's one activity that you've engaged in, maybe there's a practical next step that could move the ball down the field, so to speak, and make progress in building a more effective and successful program. But don't be intimidated by everything that's available or everything that could be done, and don't be afraid to take the next right step as that's determined for your organization.
One of the things that's really helpful in starting up, if you're having to really reinvent or start a new advanced care planning program, if you've got, and you probably do, if you've got a quality department, it's great to buddy up with some quality improvement initiative that you know advanced care planning can be relevant in, because when it's a quality improvement initiative, you've got really, those are lovely, very specific, very focused, time-bound projects where you're going to end up with an outcome at the end. So you might look at what the QI projects are that's going on and see if you can piggyback into some of that. But otherwise, everything Paul said, and give us a call.
Yep. So we look forward to hearing your questions, your comments. If we didn't get to your question, we'll respond to you individually following this webinar. And if you're listening to this recorded session, you're still welcome to contact us at 5 Wishes at any of the contact information provided on the screen. We'll look forward to talking with you. We are united with you in purpose and in mission. We're all working in different organizations and different types of organizations. Our work with 5 Wishes unites us in the purpose of honoring human dignity of the people around us, whether that's our patients or our community. And we want to be helpful to you in that effort and supportive and to understand what your challenges are. So we do love that this community creates a two-way street of information where we can hear from you and learn from you and then share among the community. So we're grateful for that. And Kathleen, thank you for your help in the creation of this community. And Darian, I'll turn the call back over to you to wrap us up.
Thank you. And with that, we must conclude today's program. We recorded the session, and we will have the archive available within 3 to 5 business days. You may access the recorded archive by visiting the 5 Wishes Practice Community page at 5wishes.org/practice. Look under webinars. Feel free to share the page and webinar link with your colleagues. On behalf of the 5 Wishes, thank you to our speakers and, of course, all of today's participants. Have a good afternoon. You may now disconnect.